Good morning. Thank you guys for joining the Medicaid Provider Appeals Process presentation. This presentation will be loaded on our web portal at www.mmis.georgia.gov. You'll go to where it says provider information, provider notices, and then you'll see all the presentations for today. They will be there for you within the next hour or two. We are posting them as we speak. Today on the call with me, we have Debbie Smiley with the Department of Community Health. Also, we have Davelin, and I don't want to mess her name up. She's with Alliant Health Solutions. She's also on the call with us. So we will get started with today's presentation. Our mission statement, the department's mission statement would be Georgia Department of Community Health will provide Georgians with access to affordable quality health care through effective planning, purchase, and oversight. We are dedicated to a healthy Georgia. Our agenda today, we will be touching on the DMA initial provider review process. We will also talk about the second level administrative review process, as well as the DMA 520A review, as well as out-of-state reviews, the DMA 520A second appeal process, as well as the administrative law hearing. We will also touch on the IVR system and how to submit a contact us inquiry to your field rep. We will also have a session review, and then we'll open up the floor for any questions that we would have received in the Q&A option today. We will be using the Q&A functionality in Cisco WebEx. So if you do have any questions, any burning matters that you have come across regularly, please indicate those in the Q&A functionality in WebEx. If it's something that we need to look at a claim, you can go ahead and indicate the claim number that you're having an issue with, as well as your contact number if it's something that's really pressing that we really may need to speak to you about. So go ahead and give us an example. It is going to come into us. The only way that we'll send it back, if it's just a general question and it's just a general response back, then we'll solicit those back to the individuals. Or we may, depending on how many questions we did receive today, we may just go ahead and cover it during the session at the end. All right. All right, so how to appeal your denied claims. All right, you're allowed to submit one DMA 520 inquiry per the web portal underneath the claims tab. There is going to be a tracking number that is provided when you submit it. You want to take note of that tracking number as well as a claim number that it is associated with. If there are supporting documents that you need to attach to that, be sure to attach that to the actual DMA functionality when you submit it. If in event that a CTN or the tracking number is closed, you would not be able to submit any additional documentation to it. And we'll cover that in the next couple of slides. All right, so some common edits that you are permitted or you can submit a DMA 524 or, for instance, edit 535, adjustments exceed timely filing, and I'll just pick on a few. Possible duplicate, a member is not eligible for nursing home date of service, billing rule not found. These are just some examples of some of the denials that you may come across that you can submit a DMA 520 for us to actually look at it, do some background and review it to see if it's something that we can process for you. All right. Some tips that we would like to cover. You want to bill within 6 months from the date of service. You want to keep your claims timely and your supporting documentation to attach to those inquiries. All right, research your claims. You may have to do some background, some history search. You may have to refer to policy to help you with your claim denials. You want to also reference the fee schedule, which is very important to see what we have out there for you, as well as submitting your inquiries through the call center and or your rep. All right, so DMA 520 documentation. Some examples of documentation that you can submit would be your EOBs, your claim history from the web portal, are some examples of some documentation that you can actually attach to your DMA 520. All right, your DMA 520 form is submitted, or they are submitted through the web portal at www.mmis.georgia.gov. You'd want to wait. Once that claim is submitted and it's denied, you'd want to wait till it completes a billing cycle. And as you are aware at this point, claims submitted by Friday at around 3 p.m., that's our cutoff time for the cycle for the week. And then your remittance advices are generated through the week, through the weekend, and by Monday, you should be able to see your remits to show all the claims that completed the cycle on Friday. And then, of course, you are aware at this point that payments are made on Thursdays now, all right? So any claim submitted by Friday, if it denied, you can start an appeal starting the following Monday, all right? Unless there's a situation where your claim was suspended, so then it'll be a delayed. You have to wait till it posts to your remit before you can submit that DMA 520 inquiry should you need to do that. All right, so search for all your denied claims that your issue pertains to. You want to submit your DMA 520 and complete all fields. A DMA 520 appeal must be received within 30 days of your claim denial date. And you'd always want to check your claim and see to it that that DMA 520 option is there for you, because if it's not and is grayed out, it does not qualify for an appeal. All right, so how to get to that DMA 520 option? You'd have to go to claims and search for your claim. If you are aware of what your claim number is, you'll search for your ICN number. You'll key in your ICN number and then hit search. If you're not sure what the ICN number or the claim number is, you'll enter the member ID, the from and through date, and then the status of the claim, and then hit search. If in fact that DMA 520 is grayed out like it is here, your claim does not qualify for a DMA 520. All right, so it must have this DMA 520 in blue available for you to select it to proceed in the process. All right, so this is what the format looks on the web portal. Looks like you'd want to complete it with your contact details, telephone number, first name, last name of whomever is the person that's responsible for the follow-up on the DMA 520. Make sure your claim number shows clear there and that member ID. And then be sure to be detailed in the written explanation box as to what specifically we need to look at. All right, so again, please be very detailed as to what we need to look at. And then you'll submit it. And then there will be a tracking number that will be provided. All right, so again, some contact information. You want to make sure it's there and it's clear and it's current. Email addresses, the reason for your DMA 520. Put in a clear explanation. If you have some EOBs that you need to attach, or specific procedure codes that we need to look at, tell us specifically what it is that we need to be looking at or we need to review. And please give us an explanation as to why you believe that your claim denied incorrectly. All right, so again, submit your DMA 520, keep note of your tracking number and the claim number that it pertains to, and then your supporting documentation. All right, so at this point, you've gotten your CTN, your claim tracking number. You'll select the attach, click here to attach your document, and then you browse on your computer, and then you upload your attachment to your DMA 520. All right, the file types that we accept are a JPEG, a TIFF document, or a PDF document. Those are only three claim type, document types that you are permitted to attach to a DMA 520. Again, is a JPEG, TIFF, or PDF only. All right, so you'd have to convert your document and then attach it. All right, so an initial DMA 520 is processed or worked by Gainwell Technologies. Once we do receive it, you'll receive an email from this do not reply at GAMMI's notification. And then you'll click there to access, where it says click here to access the web portal to get into it. All right, and then you'll have to go in, look for your document here underneath letters, and then search and click on whichever document we need to look at for your response. And this is an example of a letter that we had worked. You'd want to keep tracking of these response letters for yourself. Should you need to escalate it to a law hearing, you want to keep tracking of those letters for the DMA 520. So keep a history of that. Then if in fact that Gainwell Technologies does in fact deny your DMA 520, then you could proceed to the DC8 second level appeal process. The DMA 520 second level appeal goes to DCH, downtown DCH. It must be completed within 30 days from your DMA 520 initial appeal. So the date that's on the letter that we just looked at, you have 30 days from that date to submit an administrative appeal to DCH. Okay. Once the DMA 520 shows closed, you would not be able to proceed on this specific claim on this specific DMA 520. So it must be worked or proceed to the next level within 30 days from your letter date or the date that's on your letter. Some supporting documentation again would be, for instance, your EOB, claim history, member eligibility if it pertains to that. If it's locking information, make sure that you have all the facts, timestamps. If it's member locking information, if it's EOBs that you're going to attach, make sure that you have the most up-to-date EOB that you're going to attach to the second level administrative review to DCH. All right, so the second level is done the exact same way. You'd want to go out, do a claim search, click on that DMA 520, and then you're going to get to that administrative review button. All right, so you'll search for your claim, click on that DMA 520, make sure all your updated information is there, and so that we can go ahead and proceed. Once that is submitted, DCH reviews those administrative reviews. There isn't a time frame that they have because keep in mind that they work all different types of reviews. So depending on what's going on, they may have a severe backlog. All right, so we're going to cover that second level. You'll go back out, do your claim search. You'll click on that DMA 520 inquiry once again. And then this time you'll still have your CTN number, but then the administrative review button will be there for you to select. You'll select it. Make sure all your contact details is current and make sure that you cross-reference with your explanation. So previously you may have said A, but you may need to say, in addition to what you said before, you may need to give us more explanation so that way we can do more research because sometimes, we tend to be a little bit vague at times. Here, if it's going to the second level to DCH, we need more information to look at. We need some more justification, some type of concrete information to justify overriding your edit to pay you. All right. And then you'll go ahead and submit it. You'll then browse for your document. If you have additional documentation that you need to attach, and then upload your documentation. All right. Review your status. Search for denied ICN, select the DMA 520, select your administrative review, and then you'll need to wait for that email to notify you with the response letter from DCH. Again, DCH does not have a time frame to work administrative reviews. Depending on their backlog, we could be looking at some months. All right. All right, so this is a flow chart and the steps that must be adhered to. So your claim is denied, general denied, work your denials, review your denials. You may need to check with the call center. You may need to check with your field rep to go through that denial to see if they can help you resolve that denial. All right, because you may not even need to submit a DMA 520. All right. If you've spoken to the call center and your field rep and they tell you that that denial is a valid denial and you still believe that it is not a valid denial, that's when you can go ahead and start that DMA 520 process. You'll submit it on the web portal. It must be done within 30 days of your denial date. Gainwell Technologies must work your DMA 520 within 72 business hours. So you'd have to look for that email to click on the link to go in and look at your letters. And then if you still believe that you need to go ahead and move on to the next step, that would be where you'll submit that administrative review to DCH. You'll again come back into the claim, submit that DMA 520, select that administrative review that needs to be done within 30 days from the date that's on your letter. And then DCH will then work that as they get to that specific inquiry. Once they do respond to you, then on the date that they respond to you, you have 15 days to then request an administrative law hearing. All right, and we'll cover that administrative law hearing later on in the presentation. All right, so now I'll turn the floor over to Alliant Health Solution.
Good morning. Okay, the DMA 520A Medical Claims Review Appeals process. Next. All right. Please follow the processes outlined by the Department of Community Health. For suspended claims, supporting documentation should be attached to the suspended claim and the GAMIS claim system. Please use the appropriate attachment indicator, OZNN. B4 is used for hospice, etc. If documentation is not attached to the claim, then the claim might deny and you will need to resubmit the claim with supporting medical documentation. For inquiries and appeals, the DMA 520A is to be submitted for medical review. Appeals are to be submitted on a denied claim or denied line item. Please do not submit an appeal on a suspended claim. Include a valid ICN number that you are appealing. You have 30 days from the RA date to submit the appeal. Supporting medical documentation is to be attached to the appeal when it is submitted. If documentation is not attached, the system will auto-deny the appeal. For administrative reviews, these requests can be submitted on a previously denied DMA 520A appeal. The queue number must be included with the request. Supporting documentation is to be attached at the time of the request. You have 30 days from the denial letter to request an administrative review. Next. Please refer to the banner message posted on May 18, 2018 regarding policy clarification on submitting the DMA 520A. The banner message includes what supporting documentation is needed for the different suspended claims review types. Next. This is a continuation of the banner message. All right, in order to submit a DMA 520A appeal, you will need to sign into the GAMIS web portal. Please use the following path to request a DMA 520A appeal: prior authorization, medical review portal, provider inquiry form DMA 520A. Next. When completing the DMA 520A appeals, please enter your email, fax, and phone number if this information is not auto-generated by the system. Please select the review type that you're appealing. EMA is emergency medical assistance, medical claims, dental, or out-of-state. A valid ICN is required. Please include detailed comments. This lets us know why you are appealing the claim. Once you click on Submit Inquiry, the system will auto-populate your appeal number. This number starts with a Q. Next, please attach the supporting medical documentation for review. All right, the DMA 520A is for appealing medical claims review to be reviewed for medical necessity or an emergency. Prior authorization inquiries should be submitted directly to the PA team. This can be found under Prior Authorization Medical Review Portal. Then for PA change request, this is to be used to make changes to a pending or approved PA, to change facility or provider ID, add codes, remove codes, change numbers of units. Changes must be made within 30 days of the procedure or admission date. For reconsideration request, this is used for appealing a denied PA. You have 30 days from the date of the denial to appeal the denied PA. For PA recertification request, this is for when a patient is in a facility greater than 90 days. These are to be submitted on day 87, 88, 89, or 90. Also, the most current clinical information needs to be attached. And for PA administrative review request, administrative reviews can be requested after 2 reconsideration requests. These need to be submitted within 30 days of the last denial. Next. Okay, this is a screen print to show you exactly where to go in GAMAS. So you'll go under Prior Authorization, then next is Medical Review Portal. Next. Then you will select Provider Inquiry Form DMA 520A. Also, please note that the edits that Alliant reviews are available by clicking on the link. Next. So these next 2 slides show all of the different edits that Alliant reviews. Next. Next. Thank you. All right. So this is once you go into the, click on the DMA 520A Provider Inquiry Form. Be sure to enter a valid ICN number, which is highlighted, and also highlighted in green, you can click on this link also to see the edits that are reviewed. Next. All right, once the appeal number is generated, the Q number up at the top highlighted, please attach the supporting medical and clinical documentation. Next. In order to attach a document to a request, the document must be saved to one of your system's drives. Click on Browse, then select the file name of the document to be attached. Then click on Attached File. If a file is successfully uploaded, you will see the document shown under the attached file, and you will receive a message indicating file uploaded successfully. The following file types are acceptable for attachments: text, doc, PDF, TIFF, and JPEG. Please do not include the following symbols as part of the file name: the & sign, /, pound, greater than, less than, apostrophe, and quotation marks. The name of the file to be attached cannot be the same name of a file that's already attached. The file size for an individual attachment must be less than 20 megabytes in size. So if a file is especially large, divide the file into 2 or more files. And multiple files may be attached to one appeal request. However, documentation that is attached should only be related to the member associated with the appeal and not to any other members. Next. Notifications. The system will send a no reply auto notification once the appeal has been received. Once a decision has been rendered, a contact us notification is sent. Approved appeals are sent back to Gainwell for reprocessing. Please allow Gainwell 2 to 3 days to reprocess the approved appeal. The decision letter is attached to the contact us message. The letters are either in a PDF or RTF, which is rich text format document. Next. This is a contact us example. A decision has been rendered and an example of a denial letter is attached. Next. All right, the DMA 520A administrative review process. Administrative reviews are to be electronically requested. The process is the same as the DMA 520A appeals. The only difference is the requested review type selected should be administrative, and the queue number being appealed needs to be included in addition to a valid ICN. Only one administrative review can be requested at a time. Please remember to enter your comments regarding the administrative review request and supporting medical documentation to the appeal. If no documentation is attached, the request will be auto-denied. All of this information is located in a banner message that was posted on September 20th, 2017. Next. Okay, this shows you the paths to go through. All right, and once again, please click in Administrative Review and enter the queue number that you're appealing, and the notification process is exactly the same. All right, next is out-of-state provider administrative reviews. Out-of-state administrative reviews are to be submitted directly to DCH. These requests are to be submitted in writing. The documentation should be mailed to the address listed above. Next. Okay, this is the DCH out-of-state administrative review policy. All supporting documents should be submitted, which includes the RA, response to the DMA 520 or 520A, denial letters from Alliant, and medical documentation. Next. All right, the DMA 520A appeal timeframes. From a denied claim, you have 30 days to request an appeal. From a denied appeal, you have 30 days to request an administrative review. And from a denied administrative review, you have 15 days to request an ALJ hearing. Thank you.
All right, thank you for that, Devlin. All right, so administrative law hearing. Administrative law hearing is the final stage for a review from the state. So again, at this point, you would have completed the DMA 520 and or the DMA 520A, whichever that is applicable. And then you would have submitted your administrative review to DCH or the administrative review for nurse review. And then you would have received your responses on those. If they're all denied, whichever is applicable, then you can request an administrative law hearing. All right, so you have 15 days from the date of those last denials to request an administrative law hearing. All right, you'd want to request that in your request, you want to be clear as to your intent, what you believe should have been taken care of or addressed the issue, how we should have addressed the issue, what justification you have to say that we should have processed your claim. Be very detailed, be very clear, so that way when it gets over to the lawyers, so that way it can justify setting up a hearing for you. You'd want to have a copy of all those letters, because remember I said that you want to keep copies of those letters that we sent to you. At this point, you'd want to go ahead and include those letters when you submit this administrative law hearing request. All right. And then you have to state specifically how you believe that the state should resolve the issue. So if you believe this claim should have paid $1,000, for instance. You need to tell us the claim should have paid $1,000 because of whatever the case is. All right, and then you need to have justification to support that. All right, so this is the address that you'll need to send that request over to. If you have policy information to help you support that, you'll need to pull it from the manual, pull the pages from the manual, attach all of that to that letter that you're sending over to the state. All right, so this is the address here that you'll send it over to DCH. All right, so some reference information. Policy information is available. Provider appeals is in Part 1 policy, chapters 500. It covers the policy for appeals. As always, our provider notices, provider messages, and quarterly manual updates are available on our web portal. We do keep a history of all previous versions of the provider manuals, and all of the provider messages are there for you, and the provider notices are there for you. The DCHI newsletter is available at the address here, www.dch.georgia.gov/publication. And then claim supporting documentation attachment code, because we do constantly come across with providers submitting documentation and not indicating the correct attachment code when they're attaching the documentation. We've included all the attachment codes here for you to reference. All right. So again, provider information, provider notices, the information, policy information are available there for you. Provider manuals are there for you. Provider messages are there for you. And once you select provider messages, you'll select search. All of our provider messages that addresses policy are there for you to reference, are there for you to utilize to help you should you need to appeal, and you have policy to reference to include in any type of appeal that you may have submitted, whether it be the DMA 520, whether it be the administrative review, the nurse review. You can utilize policy to help you with any type of appeal. All right. All right, so provider messages, you can look at the messages, make sure you capture the date and whatever it says in the message to help you. As always, our call center is available to you at 1-800-766-4456. It is available Monday through Friday, 7 a.m. to 7 p.m. unless it's a state holiday. You can always utilize the IVR system to check eligibility, check claim status, payment information, provider enrollment, prior authorization, and or PIN password resets. So again, the 1-800 number, and of course, our website address is www.mmis.georgia.gov. Here is a list of the state of Georgia. The state of Georgia is color-coded by territories. Those territories have field reps available in those territories. And here is a list of all the field reps. And here is a list of the statewide consultant reps. How to submit an inquiry to your local field rep directly. You must be logged into the web portal. Again, www.mmis.georgia.gov. You'll select the login button. Be sure to utilize your username and password, and then you'll select the web portal option. Then you'll go to where it says contact information, contact us. You'll select an item. From the drop-down, there are two options that route directly to your local field rep. You can select contact my provider service rep or request a provider rep visit. It doesn't matter which one. As of right now, we are not conducting any in-person visits, but once the national emergency releases, then we'll be back on the road again. All right, so whichever that applies, contact your field rep or request a rep visit. It doesn't matter which one you select. You'll document specifically what the issue here. If it's regarding a specific claim, tell us what the claim number is. The ICN number, tell us specifically what the ICN number is. If you don't have the ICN, tell us what the member ID and the date of service, and of course the amount of the claim, and specifically what detail on the claim that we need to look at for you, and as to what specifically you believe the resolution should be, or what we need to look at. Put in a telephone number and your email address, and even the best time of day to reach you in your inquiry, so that way it helps us reach out to you. Me personally, I prefer to have a conversation, so that way if there's something that we need to look at, we can talk about it, have you to submit the claim right there and get a resolution on that claim directly in the web portal. Once you hit that submit option, it does create a tracking number. That tracking number can be tracked back at any time. So if you're submitting a DMA 520 to DCH and you've called the call center before, this is also another mechanism to show that you had already called us before. Here's a tracking number about this issue. You've already reached out multiple times. You've spoken to whomever, whatever. We can pull history from that tracking number to show that you've called before and whatever about the issue. All right. So at this point, we've covered how to submit the DMA 520, the DMA 520A, the out-of-state appeals process, and the administrative law hearing. We've also covered how to access policy information as well as any provider notices or provider messages that we'll have on the portal. At this point, we are going to go ahead and open the floor. We're going to have one of our reps to read out the questions that we have received so far, and then we'll try to address them on the call.
Thank you,
If we
Danny.
happen, all right, go ahead.
Thank you, Danny. So we have one question in the Q&A this morning. We are an ambulance provider and have high-level transports denied for needing the trip report. After we go back to the claim and attach needed documents, the claim was still denied, and we have to appeal with the DMA 520A and submit the same information again. Why does it deny once the documents are uploaded? Devlin, would you like to answer that question?
Yeah, it would be helpful if I could have an example ICN to look at.
Okay.
Yeah,
Are you able to? Okay.
yeah, I'm wondering if the claim is denying for a different edit that's posting to it besides the one that we review for the ambulance.
All right, so the individual that submitted this ambulance question, could you go ahead and provide an ICN number as well as your email address and telephone number, so that way Alliant Health Solution receives that in conjunction with your inquiry, and then we'll follow up, we'll pull the report and then follow up with you directly in regards to this matter. Do we have any other burning inquiries on the call? Go ahead and submit that Q&A for us so that way we can talk about it. We do have some time.
Okay.
All right, we did receive a question. Go ahead.
Okay, we have another question from another provider. Multiple authorizations on the same day. Are there clear steps on how to handle those appeals?
Devlin, you want to take that?
I am not sure that I'm understanding the question clearly.
Devlin,
Yes, Debbie.
I believe that this is something similar to multiple like therapies or and things like that, where or maybe they get an X-ray done and have a therapy. Their procedures they're having done on the same day, and they may be in different areas. For example, different areas within the hospital, so they'll get multiple PAs. But they need to, and they can only bill, as you know, one PA on a claim.
All right, so I
So
just sent that specific individual and unmute so that way she can go ahead and be clear to us as to issue that she's Ma'am,
Okay,
if you would go ahead.
Yes, we have situations here in the facility that we have same day, just like you guys were saying, and we have to split that second authorization off, and we have been struggling with what the process is because does it need to be done on its own? Is it a copy? Is it how do we get those authorizations done?
they should be sent on, just like you asked, if they should be done separately. They should have be separate claims so that you can put that particular authorization on the claim that's billing for that procedure.
Is the authorization duplicate denial request supposed to be done from that denial, or can it be done from the main claim?
Okay, you're billing these separately, and then you're receiving maybe the possible dupe edit.
Correct.
Okay,
Or they've
so
gone out, all of them at the same time, with our billing
mhm,
department not being 100% sure that there are multiple authorizations on that day, and we find that because we've received a denial from
yes,
for one of those items, so we have to split that out onto its own claim.
that's right. And if
So is that a copy claim when you're inside that claim function, or is there a specific way to do those?
Danny, I'm not familiar
If the
with the
claim is,
copy claim.
all right, so you're saying that the claim is denying for exact duplicate, right?
Part of the claim will.
All right, so those portions that it's denying for exact duplicate, but it's really not an exact duplicate, it's a different procedure code in general.
Correct.
All right, so then we'll probably have to look at it in detail and probably have to get with the state and or Alliant Health Solution to see if it's completely separate that we can override it, but we may need to look at it specifically.
All right, so if we've done multiple appeals and it's a process that we've done incorrectly on our side, our field rep should be able to assist us in determining what we've done incorrectly because our appeal
Yes,
continues to be
because
denied.
he or she should reach out to Alliant Health Solution as well as DCH to see if it's something that we can override for you.
Is that a DMA 520A that we would have to do, or?
Well, I would say at this point,
The
if you have
the
the claim,
duplicate edit is actually not one that Alliant reviews, so you'd
yeah.
need to submit the DMA 520.
Okay.
Well, no, in this case, you'll just submit the inquiry to the field rep. So the field rep
Okay.
can review it and then
Okay.
possibly get with Alliant Health Solutions to see if we can look at it to see if it should be completely separate
Okay, so
and then something that we can look at the
we would have
override.
to request that our field rep get with Alliant to see if this is something that could possibly be overridden to be allowed.
Right. Mm-hmm.
Okay, thank you.
Not a problem. All right, next question.
Our next question we have from another provider is for Devlin. For the administrative review appeal for the DMA 520A for out-of-state providers, you mentioned mailing the appeal. Is it acceptable for those to be submitted electronically?
Debbie, that's a policy question.
Okay, if the out-of-state provider has access to the web portal and it has everything set up to submit that electronically, then yes, they can be submitted electronically, just like their claims as well. You know, the only paper claims we accept are for out-of-state. But if those out-of-state providers have set up their web portal access, then we by all means would prefer to receive that electronically.
Okay, and our next question we are with a long-term care facility. If a resident has a change to their patient liability that is backdated by DHS past the timely filing deadline, would this be eligible for the appeal process?
All right, so
Yes,
that particular request needs to, again, be routed to your field rep. Your field rep should be working with you to look at the history of the patient liability And then your field rep should be able to get with the state on that to see if it's something that we can override. Very likely it'll be something to override, especially if it's a recent update to the patient liability. We should be able to get that to process for you with the state's help.
Okay, and our next question. With a Medicaid crossover claim where Medicare has paid, Medicaid is filed, then Medicare recoups their payment, and a new Medicare payment is issued. What is the time frame or process for submitting that new Medicaid claim for the patient responsibility? We are submitting the new Medicare EOB with a new Medicaid claim, and they are being denied as timely.
It would be denied timely. Here again, you'd want to make sure that you attach the EOB from Medicare with the new submission. We may need to look at history. So if you could pull a history search on the previous paid claim or previous submission on the web portal, or you had processed it before through Medicaid, we made a payment, or not made a payment, but it was received timely initially, and then your new submission with the Medicare attached EOB submitted, you'll submit the contact us inquiry to your local field rep. Your field rep should then work with the state to try to get that overridden for you, but you do actually have 90 days from the latest EOB from Medicare to show that there was a new submission, and we need to see that timestamp for Medicare on the EOB, so that way we can process it for you. But it is 90 days from that EOB date, whether it be a TPL claim or Medicare.
Okay, and our next question, denial stated modifier required medical review, but no other information provided. Is there another way to receive the denial from GMCF without submitting DMA 528 or calling the call center?
The review decisions are not available through GAMAS. So besides using the call center, you could also use the contact us through Gainwell, and they will respond and let you know the review decision.
Thank you. How do we find out who our field rep is?
All right, so this presentation will be available as all presentations that is held today will be located on the web portal under provider information. On the web portal, from the drop-down, you'll select provider notices. And then whether it be the opening slide presentation or this appeal presentation, it lists all the field reps based on the territories, and those territories should be color-coded. And that would be how you can determine who your field rep, depending on where you are in the state. And as always, you can always utilize that contact us inquiry like I showed you in the presentation. And when you submit that contact us, it routes directly into your field rep's box. And then your field rep would actually be the one that calls you back, because it routes when you submit it by selecting contact my field rep, as it shows here. These two options route directly to your field rep. So when they call you back, the person that calls you back would be your field rep. All right. All right, next.
Our next question, I believe, is related to the first question that we had regarding the multiple authorizations on the same day. They're asking, are those not a DMA 501 appeal?
All right, so we're going to ask that specific provider to submit her contact details for us to reach back out to her or him, and then we'll get back with that provider directly. Thank you.
Okay. Our next question, where will I submit this information if the class is over?
All right, so as always, once today's session is completed, if you all would utilize the contact us inquiry in the web portal, contact information, contact us, just as it shows in the slide. You'll select the item, select an item, contact my provider service rep or request a provider rep visit. In the box that says, how can I help you? Please be detailed as to your inquiry. If you have a claim number, tell us specifically what the claim number is. And then put in your telephone number and email address and the best time of day to reach you. And it routes directly to your field rep. Even if it's an Aligned Health Solution inquiry for the individuals on the call today, submit it here. And once your field reps get with you, we'll help you and then route it back to Aligned Health Solutions if we needed to. So at least that way we can start the process for you. All right, so again, you'll go to where it says contact information at the top. You do want to be logged in with your password. Contact information, contact us. You'll select the option that says select an item. The two options that you can utilize would be contact my provider service rep or request a provider rep visit. It does not matter what you choose. And then where it says, please be detailed as to your issue. If it's a claim number, tell us what the claim number is. If it's a member ID, tell us what the member ID number is and the date time frame that it's for, and tell us specifically what the issue is so that way we can conduct the research prior to reaching out to you. Please be detailed. It is secured, so you can place as much PHI in this box as you need to, so that way we can conduct a thorough research before we reach out to you, and then submit it, and then we'll work it within 72 business hours. All right, I think we have time for another
And
question.
also, you can submit a contact us message directly to Alliant. And under the medical review portal, you will choose contact us. And if it's regarding a medical claims review or DMA 520A, you would select that for the contact us. And be sure to include the appeal number or ICN that you had a question about, and we'll be able to respond back to you through the secure web portal. And you can also, if you have questions regarding a prior authorization or any of the waiver programs, you can also submit the contact us.
All right, so what Devlin was speaking about, if it's regarding a medical medical review or prior authorization issue that you need some help with, once you're logged into the web portal, you can go to where it says prior authorization as it says here, and then you'll select medical review portal. And then if you move all the way down where it says help and contact us on this slide, you'll select the option that says contact us at the complete bottom of this slide. And that option routes directly to the nurses. So if it's in regards to a PA issue or PA or DMA 520A that you have submitted and you needed some help with or some clarity on, you can utilize this to reach out to the nurses so that way they can reach out to you to go through whatever issues that you're having. All right. Let's go ahead and see if we can get to the last inquiry that we can handle.
The last question that I see listed here, but only if Medicaid had initially made a payment. Is that our last question?
Yeah, go ahead with that.
I'm sorry, Danny, can you repeat that?
Go ahead. Was that the last question?
Yes, and it's related to the TPO.
There's one more.
Oh, is one more here?
Yeah. It says, what is the best way to handle a claim for a patient being locked into hospice, and the hospice states that they've revoked when the patient is being transported to the hospital? So with that, you would want to submit the DMA 521 non-hospice form and include a description in there that the patient has revoked hospice prior to the transport to the hospital, and be sure to document that the patient's revoked hospice. But
Okay.
we still need that form attached.
All right, thank you for that. All right, so all questions that were received today, on all sessions today, we will be reviewing those questions and we will be working on a FAQ document that should be loaded on to the web portal underneath provider information, provider notices, and that should be available to you all within 2 weeks from today's date on the portal. I believe it's a holiday, so it may be the following Monday. So we will be putting together an FAQ for all the questions that we did receive today on all the sessions, and we will be posting those within about 2 weeks, and then we'll post them in the portal with answers. All right, so at this point, we would like to thank everyone for joining today, and we'll go ahead and allow you some time to switch over to the next session. All right, thank you.
Thank you.
Thank you guys for
Thank
joining.
you.